When I was working in industry, I had several bosses tell me that the boss that had management with executive responsibility tell me that my job was to keep them out of jail.
All right. Hi, Michelle.
Hey, Ty.
We're going to talk about subpart B from 21 CFR 820 today. So that's management responsibility, quality audits, and personnel. So let's start with management responsibility. What are the first things that come to mind when you think of that particular section?
Management responsibility, the first thing that comes to my mind is the buck stops here. Not actually here, but with the CEO of the company. And that is totally different from a management representative. Management representative is a person responsible for carrying out certain quality management system activities like management review, but management with responsibility is that person in executive management that at the end of the day, the FDA is going to write them the letter on their Form 483s or their inspection report.
Yep. Yeah. So what are some of the wildest things that you hear when you are presenting to management representatives or your management with executive responsibility?
When I was working in industry, I had several bosses tell me that management with the boss that had management with executive responsibility tell me that my job was to keep them out of jail. And that's really a pretty low bar if that's your only hopes out of your regulatory and quality department is that you stay out of jail, because it implies there may or may not be any crimes being committed, and that you might be out of trouble with the FDA by the skin of your teeth. So yeah, that to me, that's always a red flag is people who are like, I need you to keep me from going to jail. I did not go to law school against my mom and dad's strong urging, but yeah. So I'm not a defense attorney. I can't keep you out of jail.
Yeah. And then I think the other red flag that, we can see is when people are really offhand and they just want you to sign on their behalf, that they try to outsource management responsibility, that they try to, outsource as much of the ownership, if you will, as they can.
Yep. Right? Most of our clients are virtual manufacturers, if you will, meaning that they're using contract manufacturers, but many of them have also used design houses as well. And no matter how much of your quality management system and activities you outsource, you can't outsource the responsibility for them. Everything has to be controlled in one way or another, be it through your purchasing controls or your internal processes around your quality management system data like complaints.
Yeah. I think some of the challenges when you are management, and you have to deal with this very specific requirement is that it takes a lot of knowledge to do it right. You have to have an understanding of quality management systems. You have to have an understanding of what you did and didn't outsource, which means that you basically have your finger in every pie that's out there, a slice of each cake that your company has. Mm-hmm. And I know that it's always been a struggle to bring up, the education level and making sure that people understand everything that's going on in their system. How do you kind of tackle making someone a really good, executive management representative and making someone really understand their quality system and buy into quality management systems?
I think some of our best companies or customers, their CEOs, they might not can actually do the regulatory and quality activities, but they have got a working knowledge and a healthy respect far exceeding that of just staying out of jail, where they know that properly integrating regulatory and quality is necessary for their business strategy and their business success. And you know, if you think about what it means in the life cycle of a startup, you know, most startups exit strategy has got you know, something to do with a licensing or an IPO or being bought by a strategic. Well, especially strategics are very savvy these days in terms of regulatory and quality requirements, and they don't want to inherit a mess on either the regulatory or the quality side, and they'll actually ding you in your evaluation during their due diligence. So the best CEOs are seeing that, yes, you know, maybe I've hired lean RAQA in the lean team to help me execute these things, but ultimately it's the CEO's job to integrate those into a successful business strategy and plan.
Yeah. I think that that's a great answer. And that's, you know, something that anyone who's looking to start a medical device company should have that kind of mindset. You know, you should understand that you have to buy into your quality system and regulatory strategy as more than a checkbox activity. And management responsibility, the whole clause of it, you know, it has quality objectives, it has, you know, high level personnel, it has, you know, management review in it, quality planning. It's one of the sub clauses that end up, at least to me, who you know, does regulatory and quality consulting, it can feel very checkbox activity without necessarily driving a lot of meaningful things and, you know, strategic decisions or actually finding the right resources or addressing issues. And how do you shift from that mindset? Because it seems so prescriptive. And when you work with a startup and a small company, that just might not fit. You know, a management review is completely different for a company with 20,000 employees versus one with 2.
Right. And I think that there's a little bit of an economy of scale, if you will, with the size of the company. You know, 2 people, there's hardly anything that happens in the entire company unless they are deliberately not talking to each other. And I think that you just have to scale things, you know, certainly for smaller companies, having things on a quarterly basis is way too frequent. And so for things like management review is, you know, making sure that, you know, you're having them annually as part of that checkbox, but how can you look at data in ways that don't come up in your day-to-day conversation, that gives you some early signals about safety signals about your product, or feed and inform things like your design and next generation of your product or your risk management activities. You know, kind of looking at those bigger picture things that while you may get a complaint every now and then, and you may talk about the complaints as they come in and investigate them as they come in, you won't necessarily be looking at them from these perspectives that you could in a meaningful management review.
Yeah, I think that management review is an area where startups particularly can struggle so much because the data is so limited. And something that I think doesn't cross everyone's mind is that it can be more than just production data, because you might not have any production data to really look at. You might not have any complaints when you're that early, but you can always look at, you know, how your design is progressing, you know, your regulatory requirements, which you should be looking at anyway, and also your supplier performances. So there's a lot of content in a management review that maybe startups don't realize that they aren't addressing, just like you said, in their day-to-day conversations.
And I think it's also appropriate to set maybe temporary or shorter term quality objectives that will be good indicators outside of what the company would want for its normal commercialization objectives.
Yeah. And, you know, we're talking about quality objectives, but let's talk about the all-inclusive quality policy that you always hear. Is posted in the bathroom, it's posted in the break room.
And if you've got a badge, it's on your badge.
It's on your badge. It's like painted as a mural in the conference room with glass.
Because that affects everybody, right? Reading the quality policy while they're pouring their coffee is just life-changing, right?
It will tell me how I am.
It's like a mantra or affirmation.
That is the quality policy is definitely an affirmation for the company. It is a mantra. But, you know, how do you make them meaningful? Because they end up just being a statement and they just aren't, you know, they're posted everywhere. They're like the Kool-Aid. You're told that you're going to like cherry flavor and this is what we're going to say about it. And it's just never been meaningful, you know, at a corporate job really, or even for startups. So, you know, why is it included? Why do we do it? You know,
I'm not a huge fan of quality policies, to be honest, for that very reason. I've never seen one that was actually meaningful and that didn't just get posted somewhere and forgot about. Like, the extent of people's acknowledgement is when the auditor comes in, take them to the break room and show them the quality policy or read it off your badge or whatever. The way to make a quality policy meaningful is to have quality objectives that are more specific and specifically support are the means to the end described in the quality policy, and then to make management review full circle that those objectives and that end in the quality policy are both you know, meaningful and relevant for your business. That's about the extent that you can go with taking the quality policy to be meaningful.
Yeah, I think, oh, go ahead.
This is not so much the FDA, but for ISO, I would get challenged on quality policy statements because they might be missing one word. And they're like, well, it's not, because you're missing this one word or this phrase. It's not clear how your quality policy is fully supporting the objectives of, and I'm just making a clause 4.2.B.6 or what, you know, whatever. I'm just making numbers up. But so yeah, auditors in general have not helped the functionality of the quality policy of turning it into anything meaningful.
I think in industry, it's definitely become very shallow, the quality policy. Like, you know, we made a lot of jokes about how it's literally just posted everywhere and the auditor comes in and you're like, hello, I have it laminated. It is here for review and it's very pretty. But, you know, from a deeper perspective, it's so much more important to understand that you have a commitment to quality and to product safety and what you're putting out there. And, you know, that's what all the quality policies say, but I think that they're never really practiced. You know what I mean? Like, it's about practicing good quality dedication. It's about practicing, you know, it's your affirmation. So you have to work towards it, right? It's about practicing good products that you're developing, you know, making sure things are safe. That it should be your number one concern as a medical device manufacturer. But we have a good soapbox about quality policy here. Quality objectives. What are some key takeaways for management responsibility? And, you know, we've talked about a lot of things, but what are key activities you should be doing under that management responsibility kind of clause that you're looking at? So one that we've mentioned is management review, you know, looking at quality objectives and quality policy. What other things would you advise executive management to be looking at?
Oh, there's a good bit of discussion that foreshadows what's coming in other sections of the quality system regulation. And those are the resourcing of the quality management system as a whole. resources adequate to not only to support your product in terms of manufacturing, but also to support, the maintenance and administrative activities of the quality management system requirements in general. And this is where I typically see that kind of negative or antithesis or antagonistic culture begin in particularly in startups and small to mid-sized companies, is because the quality management system is traditionally under-resourced because it's seen as a overhead for a cost center rather than something that needs to be built into the cost of the product. And so when things get tight, it's they come to the the quality system personnel first to say, oh, well, your overhead, so your department needs to cut this many people, when you're not doing anything to cut the amount of activities that those people are responsible for. So I think, that kind of management responsibility section is responsible to make sure that quality has enough resources to sustain, the regulatory.
The products. We can't
Yeah.
be superhumans, you know what I mean? Like, it's really challenging when you have there are like 20 marketing people and like 20 people in the factory, and then there's 3 quality people. It's tough. Like you don't have the time to review and release product appropriately, and then everyone's breathing down your neck. You can't do proper investigations when complaints do come in. Is it something that, maybe you should be really looking at as a design? I think that that's spot on. I think that quality, as a whole, it should be built into the cost of the product, and more than, maybe I'm biased, and by that I probably am because I've worked in it. But we're asked to do the superhuman more frequently than other people.
Yeah. Yep. And those activities haven't gone anywhere. Like, even if your sales are down, like, for example, I was pressed one time to make some changes for a single document control individual. Now, the number of things that she was being asked to process had not changed, and in fact had gone up for several other business reasons. So it's like you can't have both things. You can't downsize document control and process more DCOs at the same time.
It doesn't work. Yeah, I think resource planning is it's hard because a good quality person will make it feel like you're running so smoothly, and then you wonder why you have such a good quality team, and like, oh, maybe you can cut it off because you don't feel it as much. And then you cut quality people and it's just like chugging through sludge all of a sudden. I think that that's probably the cost that people don't realize. Like, businesses don't realize is that everything's working so smooth, it's going well, but maybe sales are down and we need to cut overhead, so we cut quality, and then it's like you're just, instead of water, it's sludge now. You talked about resourcing and personnel, but there's a key person that's missing in this discussion, which is your internal auditor, right? So you have management responsibility that is supposed to make sure that your quality system is running smoothly, that they are responsible for the overall, quality system implementation and maintenance. But you have someone who's going to do the due diligence on that, and that's your internal auditor. Let's talk about quality audits and what's your impression when you hear internal audits, quality audits?
Well, a good internal audit should almost be an executive summary, or like you said, a due diligence on the state of the affairs and the health of your quality management system. And the management with executive responsibility should have a very vested interest, because again, they're the person that's going to get the letter with from the FDA with their name on it. And when I was running audit programs, one thing that was really important to me is that whoever I was interviewing as part of the internal audit felt like by the time an external auditor came in, that they had been asked all the questions, that they knew what to expect, that there weren't any surprises in the quality management system in either the records or the way that we were prepared to handle audits. And that's really important because several times in my career, I've had FDA just walk in with either absolutely no notice or less than a week's notice. And so unless you're using your internal audit system to keep people prepared, keep them used to the types of questions that they're going to get and the way that they're going to get them, those audits could just as easily as be a train wreck as they could be successful.
Yeah, that's very important because, I think a lot of small companies and startups don't necessarily realize the extent of people that can be brought into an audit. If you have pilot production, your quality people can only speak so much, but an auditor can go out on the floor, they can ask questions, they can want to observe, really it's at their discretion. And so using your internal audit to prepare your team is, an excellent way to double dip essentially to meet the requirements and provide, valuable experience to the team.
Mm-hmm.
I used to do a lot of internal audits and I still do. And something that I think is always frustrating when you're an auditor is that I feel like internal audits should be strategic in nature and not combative. When you're kind of an external person and you're brought in, sometimes people want to, shut down. They just want to do a checkbox activity. They don't really want to know about the health of their system. And kind of how do you help navigate that challenge?
I just think it's important that the auditor has a disarming personality and not like I've seen a lot of auditors that are almost condescending because they act like they're the auditor. You can't argue with me. The regulation's a regulation. These are the facts. And I think that there has to be like an engagement and a level of conversation that happens during an audit so that people are comfortable and don't feel like you're out to get them.
Yeah. And, I think that that's so important is having auditors that have good dispositions and good understandings. What's your experience when you have a decent sized company and a lot of times they just use internal auditors that already work for them versus hiring someone external? There's a lot of strengths and weaknesses in that kind of approach.
Yep. Well, one of the strengths is that, that's a good way to manage your cost. But a lot of times internal people don't have the extensive certification or backgrounds that you can get by hiring a external person to come do it. And then also having an external person come, me and my team, we have seen dozens and dozens of different types of quality management system in different states of repair. We've seen things done, many different ways. So, a lot of times if you have an internal auditor and they've only seen your system or maybe one or two others in their career, they might have blinders on. They might think that there's only one way to do things. And they might not have a certain broader perspective or be able to come to the table with, ideas of how things could work better as well.
Yeah, I know one of my challenges when I was in industry was that, you can come in as an internal auditor, but it's harder and more intimidating to challenge on systems that have been in place for a long time. That can be really hard, when you're coming in and you are doing internal audits for the first time for this company and you see that something's wrong, you're going to write it up, but then you have to talk to maybe the head of that department about the deficiency that you found. And there's not kind of that, degree of separation, even though you think there is, because you don't report to them. That can always be kind of challenging with internal auditors too. I know that I have been in that position, and that's kind of a tough spot to be. Having people external completely to your team will give you a better unbiased review. But then you have the other flip side of that, auditors who only know how to audit, and they lose their practicality. You and I have both seen this all the time when we, go to do an internal audit and you look at the last audit report and you're like, what? How are you writing against this? This isn't a requirement. This is like a nitpicking nuance that doesn't have any meaning to the company. What's advice that you give for external auditor, like when you're looking for an internal auditor?
Well, I think one thing that sets us and our team apart is that everybody has actually done the work too, on both the regulatory and quality sides, and not just know the requirements and how to audit to them. So I think it's totally different having somebody that knows what the work looks like and what it takes to do it in all practicality, and not just how to go down a checklist and check a box that you have a procedure and you're doing what your procedure says, but that things are actually meaningful.
Yeah, a good test for people who want to test their auditors is if they ever challenge you because you don't have the exact verbiage out of the ISO clause or whatever. I feel like that's one of the quickest things that you can quickly understand that someone doesn't have a full understanding of what they're actually discussing, or might not have the experience of doing that. You worked in production, you've done internal audits, you had big companies, it just working in the system and then moving into quality and audit does provide a different experience, because I'm not just, we're not just reading, all right, section 4.1, it needs to say exactly this. And you can tell a system isn't very good when you see that too. When I'm like, oh, I'm reading ISO 13485 or I'm reading 21 CFR 820. I'm like, oh, these people
copied and pasted and
copy and pasted it. Do they actually know what they're saying that they're doing?
Mm-hmm.
For internal audits, is there any advice that you would give specific to small startup companies that might have low volume and low production, and how does it make sense for their overhead and the scope of activities to do an internal audit?
I think that when you first go into commercialization, you need to do one as a kind of a baseline to kind of set the stage going forward for your quality management system, and really understand the frequency and the volume at which you're going to get data to analyze. If you are in really low commercialization volumes for one reason or the other, and you're not getting, much complaint data, you're not having a lot of manufacturing or supplier issues come back, and there is really little, very, very little to look at on an annual basis, you might be able to do a management review or two and set that baseline for your data, and that you don't have enough data to create a trend on a yearly basis. There's only two of you, so it's not like something's going to happen that one of you doesn't know about. So, I have been successful with some companies in such a circumstance where we set a risk-based frequency to maybe every other year instead of every year for the internal audit. but that's discussed as well in a management review. And the decision is discussed in a management review as a topic, a decision's made, it's documented in the minutes, it's documented in the quality management system procedure for internal audits, and then it's reassessed in those years in between.
Yeah, and that's a great way to make your management review more meaningful. You know, instead of that awkward checkbox activity that it can feel like for a small pre-production company. All right, let's talk about personnel and training, because it's an area as an auditor that you frequently write up against. There always seems to be gaps in having training requirements established, having a well executed training onboarding plan, overcoming the challenge of good training versus tribal knowledge. We'll talk about all of this and roll in it, but there's a whole subsection on personnel and training in the 21 CFR 820. What makes good training to you? Is it just read and understand? Is it, give me some insight into how you approach training.
Yeah, this one's a little tricky at a super small company and a startup, especially if there's not a whole lot of personnel, a turnover, and they've outsourced about everything that you can in terms of contract manufacturing, distribution, fulfillment, so
not management responsibility.
Not management responsibility. We've already seen how that ends up. And I also think that this is a difference in how the FDA and ISO sees training. I think the FDA is still largely happy with a read and understand, signature page type situation, which honestly for quality management system procedures, there's not a whole lot more to it than that. But where ISO is starting to lean is the auditors wanting to see some type of, like, say, quiz or some kind of documentation where that was, physically assessed, that they really did understand, what they read. I think, management review is another good area to be able to assess your training program. Did complaints get opened when they should have and appropriately? Did non-conformances or supplier corrective actions get opened timely and on issues that they should have? And if those things aren't happening, if you have data that indicates elements of your quality management system aren't happening or aren't happening at the right times, that's a good sign that somebody's not understanding how or when to use your quality management system.
Yeah, I think that, there's some areas where that's a great point. It's about the timeliness indicator, because, a lot of times you can work with a team in marketing and they have a complaint that maybe they found 5 days ago. They were still discussing with the customer, but they never forwarded it to your quality or regulatory department for adverse event reporting. And, you have a requirement to do that basically in 2 days to make sure that it's not reportable. So that is a good place to have an indication if your training program is meaningful, if you see a trend that things aren't getting open quicker. Another area that I see training is really well documented from a production standpoint, workmanship and on the job training, making awareness of defects. But sometimes production is trained very well on how to make good product, but they're not trained very well on how to work in a quality system. Kind of what's your experience with that?
Yeah, I think that's a great point. There's a difference between knowing and having the workmanship criteria to identify if the product was made correctly, but what happens when it was not made correctly and what to do with it is just as important as what to do with it when it is made correctly. So being able to understand when to write up a non-conforming material report on it, when is something significant enough that it needs to be brought to the attention of purchasing so that they can contact the supplier. When do you need to do inventory evaluation of product you have on hand? All of these things are signs of being able to know what to do when with your quality management system, and getting it documented and contained appropriately is just as important, if not more important than building the product right in the first place. And an example of that is when I worked at a big medical device and pharma company, the FDA came in and they walked through our batch record room, which was, I mean, hundreds of thousands of batch records. And they walked down and they just randomly pointed to 5. And the first one he audited had a sterilization out of limits. It had a label reconciliation. It had like the biologic, something grew in it. It had a chem lab out of limits. It had like, there were 5. Any one of them was a
big deal,
much less 5 all in one line. And we were just all holding our breath and we're like, crap, how did he, out of hundreds of thousands, how did he get this one? And we're just holding our breath the whole review. And he's like, I can stop now. After he reviewed that one, he's like, I saw when everything went wrong and you did it right. And this is why you have a quality management system. And I'm confident that you've used it correctly and that you contained your product correctly. And I don't need to look at any more batch records.
Wow, that must have felt so good in that moment. I'm sure you were just like, I could, like the first one, I'm sure you could even see it in my face when you said the sterilization was out of limits. And I was like, oh no, how did this get released? That's scary. That's really scary. But that's a great example that your quality system is working well. I was going to mention that the other thing I know that I had talked to someone on my team once in the past, and there was a heat sealer, and it was just starting, like over the course of 6 months, the heat was just increased a little bit every time. And we looked and it was still within limits. But I asked this person, I was like, have you ever brought to anyone's attention that this is like a full degree different now by this point, like running consistently a little bit hotter? And he was like, no, I didn't even think about that. Is that an issue? But I'm like, it's not, but are you going to wait until it is? Like, you're going to wait because you see your seals going hotter and hotter and hotter. You're going to tout quality. We should probably revalidate, maybe take a look at our sealer and see if it needs some maintenance. But oh, that batch record story, that still makes my heart like, ooh. I bet that was probably a lot of feelings all in one moment.
Because it was literally all of the exceptions you could have. So we had all the feelings about it. So with that, I think that we have done a pretty thorough treatment here of management responsibility, quality audit, and training. So if you guys missed it, we have part 1 that's kind of a general overview of the quality management system in general. We also have design controls as its own separate training on YouTube here. So be sure to look at those if you want the rest of hearing me and Ty get on our soapboxes about all kinds of things.